Good morning, this is Katie Anson, and my final paper was on substance abuse within the Alaska Native cultures. The first thing that I wanted to focus on was every culture is going to have different views on what is actually alcohol abuse and drug abuse. And if we look through the Western lens, so to speak, we can't really get an understanding of the native cultures. We view substance abuse differently. Drugs within the Native American and Native Alaskan cultures can actually be used in religious ceremonies, which in the Western society we view that as still drug abuse. And specifically, they use the drug peyote, which again, we see that as drug abuse, where they don't see that as drug abuse, they use it for religious experiences. Violence is another main concern when it comes to drug abuse within the Alaska Native cultures. Violence can contribute to people choosing to use drugs. There's a much higher rate through the national average for Native cultures compared to any other culture in America. Sometimes drugs and alcohol can be used as a coping device. So if there was violence involved and then they decided to deal with their violence by using drugs and alcohol. And once you start, it can be very easy to get addicted to drugs or alcohol. Mental illness is another issue concerning drug abuse. Native Americans and Alaska Natives have a higher rate of mental illness compared to the national average. They're also less likely to ask for help or to seek resources with their mental illness because it can be seen as a weakness within Native cultures to actually admit that there's something wrong and that they have a problem and they need help. So we need to be working on and finding culturally appropriate ways to provide these resources where they don't feel like asking for help is a problem. Many of the articles that I read for this paper, the researchers were saying that there's not enough good resource or good research to on Alaska Natives. They just have not been studied enough. We don't have enough data. And much of the data that we do have is old and dated and doesn't really apply anymore to today's issues. There's also just poor quality. We don't have the research that we need because I think that a lot of the research conducted was not done in a culturally respectful way. And if we're not researching them correctly and appropriately, then the data that we have is just not suitable. So I also looked at how Western and Native cultures view their children. And one thing that they had in common was that they know that the way that we raise our children will affect them as adults and also how they make decisions as adults. We know that the experiences that kids have affect their brains and how they are developing, and much of their decision-making skills are developed when they're children. And this goes hand in hand with drug abuse because if we're not teaching them how to make the decisions that they need to make as a child, then it's very easy for them to make a decision, a poor decision, to start using drugs or to start drinking. And even at a young age, some children and adolescents choose to start using alcohol and drugs. Something else that we need to keep in mind is that Native children go through different experiences than Western children do. And in order to better treat alcohol abuse or drug abuse, we need to remember that Native children have had different life experiences than Western children, because if we don't keep that in mind, then we're not going to be able to relate to their cultural and other experiences that they had that really did affect how they are making their decisions now as teenagers and adults. Psychological problems is another issue within the Native community. Researchers have discovered that there's a higher rate of depression, anxiety, and PTSD within the Native populations. All of these are treated with prescription medication, which can also be very addictive. We've recently seen that prescription pain pills have been something that people are getting addicted to. And not that these are treated with pain pills, but the medication for depression and anxiety and PTSD can also be addictive, just like illegal substances can be addictive. The final thing that I looked at was the amount of stress that Alaska Natives have to go through. They have many more stressors than we do in the Western world. Just their environment alone is stressful. They have to hunt and fish for their food where we can just go to the store. They deal with other health problems, which is, of course, stressful. We know that the abuse rate is higher in the Alaska Native culture, and they do go through discrimination just as other cultures do as well. But of course, that can be stressful as well. So with all of that combined, they just have a lot more stress that they have to deal with, and these can all lead to drug and alcohol use, and then eventually can lead to drug and alcohol abuse. So in conclusion, Native Alaskans have a higher rate of alcohol abuse, drug abuse, physical abuse, and they go through a lot more than we do in the Western society and deal with these issues. However, they're not dealing with them in a way that is healthy, and we need to come up with some ways that are respectful and culturally sensitive to them so that we can help them and provide resources so that they know how to deal with these issues in a way that's healthy for them. And I think by providing education resources as well and starting when they're children will make a big difference, because like I said, that's when those decision-making skills are formed, is when they're young. So just allowing them to know that it's okay not to do drugs and alcohol can have a good effect on them when they're older, and it's an option for them when they are older. So once again, we just need to come up with ways that we can research and study and provide these resources so that we are able to help them out, so that they can be healthy. Thank you.